wash my hands. Gonna enter the patient's room and provide privacy. Hi, my name's Caitlin. I'm gonna be your nurse today. Can you tell me your name and date of birth? Okay, and then I'm gonna double check that matches the wristband. Okay, that all looks good. Okay, so I reviewed my patient's order and I'm gonna be running normal saline 500 milliliter bag at 125 mils an hour over 4 hours. This will be for fluid and electrolyte replacement, and I'll be sure to monitor the patient for fluid overload. And then I'll also be running a piggyback on this normal saline, and I checked and those are compatible, so I'm going to be running ceftriaxone 1 gram in 100 milliliters IV every 8 hours, and I'll infuse that over 30 minutes at a rate of 200 milliliters an hour, and that will be for the patient's UTI. So now I'm going to get the medications from the Pyxis. Okay, so I have the ceftriaxone. I'm going to do my first check, and then I'm going to grab my supplies and go to the patient's room. Hi Robert, I'm back. I'm here to give you your medications. Can you tell me, do you have any allergies to any medications? No? Okay, great. So I'm just going to tell you about the meds that I'm giving you today. So I'm giving you normal saline, which is just for fluid and electrolyte replacement, and I'm also going to give you an antibiotic called ceftriaxone. So for this antibiotic, we'll just monitor you for any stomach upset, and then we'll also just let me know if your IV site starts to hurt or anything like that. So now I'm just going to take a look at your IV site. Does it hurt you at all? Any pain here? No? Okay, great. So I'm also going to be looking for redness and swelling. I don't see anything like that, so looks good to go. Okay, so now I'm going to log onto the computer and pull up the EMR. Can you remind me your name and date of birth? Okay, great. I'm going to scan the patient's wristband and make sure that it matches the EMR, and it looks like it does. So now I'm going to scan the medications and do my second and third checks, confirm the 6 rights, make sure it all matches on the EMR. So that looks good. The same thing with this medication. Do my second and third check and check the 6 rights, so that all matches. So now I'm ready to hang the medications. So I'm also going to be flushing the IV site before hanging the bag, so I'm also going to scan that as a PRN flush. So I'm going to check, and that looks good too. Okay, so I have my saline flush and my chlorhexidine wipe. I'm just going to be flushing the IV site to make sure that it's patent. So I'm going to clean the hub. And I'm just going to flush, checking for signs of infiltration, and just making sure that all the saline is going into the patient. Looks good, so now we're ready to go.
Go.
Okay, so I have all the supplies in the room. I'm going to spike the bag now, being sure to maintain sterility, and I make sure this is clamped as well. Okay, I'm going to hang the bag. And I'm going to prime the tubing, make sure to get all the bubbles out. Okay. And I'm going to clean this hub one more time with chlorhexidine and attach it to the patient. Okay. I'm going to insert this into the pump. Okay, so now I would spike and prime the ceftriaxone as well. And while priming this, I would make sure not to waste any medication, so be really careful to get the bubbles out. Okay, so that's ready to go. And this leaks, so just for the purposes of the video, I'm not going to hang it up. But I would hang it right here. And then I'm attaching this to the Y site on the normal saline primary tubing. So I would clean this with chlorhexidine, and then attach. Okay, so that's attached. I would lower this down. And then the ceftriaxone would be hanging here. So now I'm going to program the pump. Okay, so I'm going to hit channel select, guardrail IV fluids, normal saline, yes, and then rate of 125, volume to be infused 500, and then I'm going to hit secondary so that I can program in my ceftriaxone. So that's going to be at a rate of 200 milliliters an hour. Volume to be infused 100 milliliters. And then now I'm ready to press start. And then after this, I would also make sure that both of the bags as well as the tubing are labeled with my initials and date.